the numbers, the daily case counts today, is there anything more that you can say about the effectiveness of the no indoor gathering restrictions based on today's numbers? And I just wanted to clarify, is the death in long-term care where there's an outbreak, was that Victoria, please?
No, it wasn't in Victoria. It was in the Interior Health Region. So there's, unfortunately, it's hard to correlate exact numbers to the measures. I can tell you that our numbers and the numbers of contacts that each case is having, that's another thing that we follow in public health. And we were seeing cases have large numbers of people that they had close contact with at the time they were infectious. And since we have put in the suite of measures that we did a number of weeks ago, and increasingly people have decreased the number of social contacts they've had, no matter what context that was in. We are still seeing that transmission is primarily related to social connections in people's homes, where they have groups of people over, when they're meeting with groups of people indoors. And that remains a challenge. Even if it is smaller numbers now, that is still where we're seeing most cases. So yes, we've seen some impact of the measures that were put in place, and that's important, but I need to remind people that the indoor settings, when you have people over, even with the best of intentions, those are risky settings right now, and we're bringing things home to our family, to our household, and it's being transmitted to everybody in the household. That is the impact we're seeing from the strains of virus that are circulating right now. They are more transmissible. So when before, if somebody got sick from a contact they had at work and came home to their family, there might have been one or two other people in the family that caught it. But now we're seeing everybody get it. So that is why it is so important for everybody to pay attention right now. And I hear from my colleagues in the ICU, and I've said this a number of times, that they have whole families who are admitted to hospital, and an aunt needs to take care of the children because the parents are in hospital right now. We've had tragic cases where two husband and wife are in the ICU together. And that is what we need to stop right now. And that's why it's so important to review those safety plans in the workplace, so that you're not giving opportunities for the virus to transmit, and to step back from those social interactions, particularly indoors.